Which of the following advice is given to a client with plaster of Paris? A. Elevate the casted extremity. B. Cast should not be wet, cut or heat. C. Move the digitals. D. All of the above. And the correct answer is D. All of the above. It is important to take care of plaster to minimize the risk of complications such as skin infection. For that, keep the plaster dry. Do not paint the cast. Keep dirt and sand away from the plaster and avoid heating the cast. What is the common cause of ascites? A. Dehydration. B. Cirrhosis of liver. C. Appendicitis. D. Bleeding disorders. And the correct answer is B. Cirrhosis of liver. Ascites is the abnormal collection of fluid in the abdomen. What term is used for inflammation of gum? A. Gingivitis. B. Glossitis. C. Stomatitis. D. Adenitis. And the correct answer is A. Gingivitis. Gingivitis is inflammation of gums. Glossitis is inflammation of tongue. Stomatitis is inflammation of oral cavity. It is also known as mucositis. Adenitis is inflammation of lymph node. It is also known as lymphadenitis. Which of the following is most significant symptom of hypokalemia? A. Increased pulse rate. B. Muscle weakness. C. Muscle irritability. D. Hypertension. And the correct answer is B. Muscle weakness. Hypokalemia is low potassium level in the blood. Normal level of potassium range is from 3.5 to 4.5 mmol per liter in adults. Some significant symptoms of hypokalemia are muscle cramp and weakness, muscle twitches, abnormal heart rhythm, kidney problem. If the client complains of abdominal cramps while administering enema, the nurse should A. Continue the administer enema. B. Slow the rate of enema. C. Stop giving enema. D. Administer analgesic. And the correct answer is C. Stop giving enema. Abdominal cramps may happen during administering enema. If abdominal cramps or pain is experienced when inserting the enema tube or pushing the enema fluid into the colon, stop the enema immediately and call healthcare provider. Poor oxygenation of the blood will affect the pulse rate and cause it to become A. Bounding. B. Faster than normal. C. Irregular. D. Slower than normal. And the correct answer is B. Faster than normal. Poor oxygenation of the blood increases heart rate and cardiac output via B. adrenergic stimulation. The fall of temperature step by step in a zigzag manner is termed as A. Lysis. B. Crisis. C. Homeostasis. D. Thermostasis. And the correct answer is A. Lysis. Lysis is the gradually decline of the fever, and crisis is a sudden return of normal temperature from a very high temperature. What are the common cause of hypokalemia includes? A. Immediate period burn injury. B. Addison's disease. C. Renal failure. D. All the above. And the correct answer is D. All the above. Some other common causes of potassium loss include excessive alcohol use, chronic kidney disease, diabetic ketoacidosis, use of diuretics, excessive laxative use, excessive sweating, vomiting, diarrhea, etc. What is the function of potassium in the body? A. Sustaining regular heart muscle activity. B. Skeletal and smooth muscle contraction. C. Normal digestive and muscular function. D. All of the above. And the correct answer is D. All of the above. Other functions of potassium in the body are maintaining normal blood pressure, transmitting nerve signal between organs, controlling muscle contractions, ensuring water balance within the system, upholding accurate heart rate, preventing stroke and heart diseases. Which of the following enema used to destroy and expel the worms? A. Oil enema. B. Purgative enema. C. Carminative enema. D. Antihelminthic enema. And the correct answer is D. Antihelminthic enema. Antihelminthic enema is given to destroy and expel the worms from the intestine. What is the position for flatus tube insertion? A. Left lateral. B. Right lateral. C. Knee chest. D. Prone position. And the correct answer is A. Left lateral position. Providing a left lateral position facilitates to release gas easily. Sudden loss of urine with straining is called as A. Stress incontinence. B. Urge incontinence. C. Overflow incontinence. D. Functional incontinence. And the correct answer is A. Stress incontinence. Stress incontinence happens when physical movements or activity puts pressure on the bladder, causing to urine leakage. Agent used to inhibit the growth of microorganism is called A. Antiseptic. B. Bacteriostatic. C. Bactericidal. D. Disinfectant. And the correct answer is B. Bacteriostatic.